My name is Mbianyor Bill. I'm a medical doctor working at Fako Heart Center in Cameroon, also a volunteer for Hero Cameroon. I'd like to thank the organizers for giving me the opportunity to present this poster, which is a summary of some of the research work that we did in Buea. So the title of this abstract, if you can see my screen, is a level of use of digital health amongst healthcare workers in Tiko and Buea health districts in 2021. So this work was done by myself and a few other collaborators. So the background of this work is, over the last century, all sectors have noticed that there's a kind of a switch from the paper-based to digital systems in terms of everything from digital marketing, digital banking. So everybody's going digital, especially with the onslaught of the COVID pandemic. So and digital health, people have started to take an interest in digital health, which has been defined in other places as the use of, as divided into two branches: e-health, m-health. E-health, which is electronic health, which is the cost-effective and secure use of information and communication technology in the domain of health sciences. And so it has been shown to transform the health sector with concrete benefits already of some mobile health technologies. And so, like I said, most low and middle income countries are transitioning from paper-based to digital information systems. And so we've noticed that technology and data, the use of technology and data in the health care setting is making for more accurate and timely decisions in terms of preventing and responding to outbreaks. And especially in the African context, where the recurrent outbreaks, the Ebola outbreak, the sporadic cholera outbreaks, or measles outbreaks, the use of technology can really help in the fight against some of these outbreaks. So healthcare workers, when they are trained and empowered with these technologies, can, of course, be of very, very big influence in the fight against many of these outbreaks. So we sought out in this study to know exactly in the two districts, health districts, that is Buea and Tiko health districts, what digital devices and tools were available to healthcare workers. What was the perceived utility of digital devices by healthcare workers, and then to identify the main reasons why healthcare workers use technologies, what were the major barriers they encountered, and then to assess, of course, the level of use of digital health on the whole, and what were the associated factors. So the study was a hospital-based cross-sectional analytics study, which we did in the Buea and Tiko health districts of the Southwest region from January 10th to May 10, 2021. These participants were mostly healthcare workers who worked in the two districts who consented to participate. We excluded healthcare workers who did not have direct access to patients, clinical or paraclinical data, and who worked in two or more health facilities at the same time to avoid the duplicate data. Now, we used probability proportional to size sampling to obtain a total of 28 hospitals from the two health districts. And then by simple random sampling, we selected which of the health facilities to visit in the two districts. 1/3 of the healthcare workers were selected by stratified sampling in each hospital. So we went through the ethical clearance procedures, and then we got administrative clearance. Also had the participants sign consent forms before we administered the questionnaire. We entered and analyzed our data with AP-info and the outcome variable, which was using digital health, which we defined arbitrarily here as any participant who made use of at least one digital health intervention or one digital health intervention and two digital health tools, or at least two digital health interventions. Our p-value was set for a level of significance if it was less than 0.05. And we used the multivariate logistic regression to test for independent associations. So what do we find? We found out that first of all, we recruited 221 participants with a mean age of 33.91 years. Most of the participants were females, nurses, and had been working for between 1 to 5 years. And this mean age of 33.91 years shows that there's a lot of opportunity, because if young people are getting more, if the health care setting in this LMICs, like is our context, is characterized by more younger populations, it means that there's more possibilities to adopt technology. So the most available digital devices in the healthcare facilities were the fixed phone and desktop, which in other places have been shown to, there's a decline in the use of these devices for accessing of any technology. So which kind of here acts as a barrier to us in these two health districts to the implementation of digital health. So most of the participants that we found own the smartphone, which correlates with other studies that have been done, notably in countries like the US and the UK, where most participants, healthcare workers, were shown to have a smartphone and found it to be very useful for their healthcare work. So 68% of our participants had never used an electronic patient record software. So, and amongst the people who used an electronic patient record software, only HIV nurses had the highest access. So this shows that HIV programs already are making use of some of these digital health interventions like electronic patient records. And so it's already implemented in one setting of the healthcare, in one area of the healthcare setting, it's possible to scale to other areas. So there's actually opportunity for the implementation of digital health tools or digital health, sorry. Now, other digital health tools like Microsoft PowerPoint, Microsoft Word, Excel, and others were still below 40%. I'll just show you this in the graph right here. So on this graph, we realize that most digital health softwares like telemedicine platform, only a very few amount of participants recorded having used it always or often, while the majority of participants no use it at all. These are some digital health interventions we see for health tracking apps, like fitness apps, e-booking software are still unavailable in these two health districts, e-prescribing software, imaging software, diagnosing software, and research software. We realize also that research software were the main research and diagnosing softwares were the main softwares that were used. So it gives opportunity for the implementation of clinical decision support systems, which could help clinicians make better judgment on the management of patients. So like I was saying, digital tools like MS Excel, MS PowerPoint, MS Word, all of them are still below the 50% mark in terms of people who use them often. So the use of digital tools for healthcare purposes is still low in these two settings. So, like I said, the major reason why participants use technology was for healthcare research. 58.7% of participants do not have access to the internet. These results are not displayed there, but yeah, on the chart, but internet access was still below the 50% mark in most of the health districts. And this also limits the amount of the access and the use of technology by healthcare participants, because most technologies depend on the internet for use. So most of the participants here, which have received basic training on ICT, so know how to use basic computer software, know how a computer works, could run basic computer programs. And so if this presents another opportunity for the implementation of digital health, because it streamlines the amount of costs that is going to be incurred in training participants, in training healthcare workers in these two districts on the use of digital health technologies. So the most frequent barriers that we had in the two districts we found were unreliable power supply and recurrent technical failures like poor internet access. And this is also similar to other studies that have been done in Africa, in other low and middle income countries or in other countries in Africa where power supply and recurrent technical failures are still pose a major problem. So for the full implementation of digital health, we have to be looking at other power sources, at how to use renewable energy sources, or how to stabilize the electric supply. And then the prevalence of digital health amongst our participants as defined above. So participants who used either two digital health interventions or one intervention and two digital health tools was 39.7%. And the interesting thing we found was participants who owned a laptop, shown here with the p-value of 0.046, had internet service provided in their health facility, or had received professional training on the use of ICT, information and communication technologies, were more likely to use digital health than the participants who hadn't. So this tells us that the use of modern devices in facilities like laptops the use of provision of internet services in health facilities, and of course, training healthcare workers on the use of information and communication technology could have significant benefits for the implementation of digital health. So on this note, I'd like to conclude my presentation, and I'm open for any questions. Thank you.